So good morning, everyone. Good evening and good afternoon at various parts of the world. We are on the 80th session of CMAAO, International Weekly Meeting. And today we are bringing the update from various countries. It is always our endeavor that we try to bring knowledge. So we have various knowledge boosting session, think tank, discussions on how to handle the COVID situations and various other things. So today we have 19 countries which represent the Confederation of Medical Association of Asia and Oceania. I would introduce the regular participants in the group. We always have Dr. Chong, who is the chair of Singapore Medical Association, Dr. Ravi Naidu, Malaysian Medical Association, Professor Nazmi from Pakistan Medical Association, Dr. Alvin Chang from Hong Kong Medical Association, Dr. Matanda Pillai from India, Dr. Salma Kundi from Pakistan Medical Association, Dr. Angelica from South Africa Medical Association, Dr. Akhtar Hussain from South Africa Medical Association, Dr. Jamaluddin Chaudhary from Bangladesh Medical Association. And then we have Dr. Mukti from Nepal Medical Association and Dr. Prakash from Nepal Medical Association, Dr. Subramaniam from Medical Association, Malaysian Medical Association, Dr. Sajad from Pakistan Medical Association, Dr. Benet from Philippines Medical Association, Dr. Deborah from Brazil Medical Association, Dr. Mary from Japan Medical Association, Dr. Russell D'Souza from Australia UNESCO, Chair of Bioethics, Dr. Kazi Wazik from Pakistan. He's a president-elect of CMAAO. And then we also have Korea Medical Association. We have Dr. Sanchita from IGCP Group India. So let's start. Can we have an update from South Africa?
Morning. Sorry, I was just looking for my unmute button. I will ask Dr. Hussain to give the current stats, but what I will do is give a bit of feedback what we are currently doing. As Atkar said correctly, our vaccination program is not really on track the way it should be. We had yesterday 20 million dosages administered. Unfortunately, not all are fully vaccinated. Some of them only had one jab. Sorry, that brings it about to. I'll come back to the presentation, the percentages now. But we also started, or we have approved that from next month, we will vaccinate children between the ages of 12 and 18. So they now become eligible for vaccination. We are busy in the background with the recommendations to the Minister of Health for healthcare workers who received Johnson & Johnson in February or more than 6 months for us to motivate for either a second Johnson & Johnson or a Pfizer vaccine. And we are trying to get the department to agree that the doctors or the healthcare workers must have a choice whether they want a second Johnson & Johnson or a mRNA vaccine like Pfizer. There's very good data regarding a adenoviral vaccine then combined later with a booster of a mRNA or the other way around. So we are in that process, and hopefully that recommendation tomorrow will be a discussion again, and that we get that out before the end of next week. We are, however, concerned regarding our elections coming up. that maybe that will trigger us into an earlier fourth wave, but only time will tell us. Then we have also motivated that people living with HIV/AIDS with a lower CD4 count, who has been fully vaccinated, get a third vaccine. In our country, that would be normally Pfizer. As the study shows that some of them, especially if the CD count is less than 200, would need a third dosage. And we also have what we call VUMA weekends. The second one will come up where the private sector with the public sector have weekend drives where we try to vaccinate again as much as people as possible to make it easier for them over weekends to come for vaccines. And that is the big things that is happening currently in the background. I'll just look at that figures regarding how many people has been vaccinated. But maybe Atkar's got it, but if he's not, then I will quickly come in and give you that figures. But over to Atkar in the meantime.
Thank you very much. Thank you, Chair. Thank you, Saurabh. In South Africa, total new cases last 24 hours, 733. And the death was 54 in South Africa last 24 hours. We have total 2.9 million cases has been reported and 2.8 million people have recovered. 22,933 cases till today is active COVID-19 cases. Total death till now is 88,562. So our positivity rate from 3rd October to the 9th of October, 3.3%. Our hospitalization around the hospital in South Africa, 5,000 cases were admitted till now. 781 in ICU and 386 was on a ventilator. So our recovery rate now gone up to 96.2%. And total vaccine is around 20 million we have till yesterday. Thank you, Chair.
Thanks. If I can quickly come in and give you some more background. So according to the South African Children Act, consent for treatment is currently not required, and we are on our electronic system for registration. It's being amended to include parental consent for some of those parents that would like to give it. But again, according to our Children's Act, consent is not necessary. And children will receive 1 dose of Pfizer due to the risk of myocarditis instead of 2 doses with the Pfizer. And then the other thing that I think is important this is the vaccinations that I was talking about. Total individuals that is fully vaccinated in South Africa is 26%. And then in it was total dosages yesterday was 20 million. And then the individuals vaccinated 34%. But remember, some of them still have to get their second Pfizer jab. That's why we say only 26% of adults has been vaccinated so far. Thank you for that.
So thank you. I believe in South Africa, they're pushing to open the schools, and that is why they are trying to, push the vaccination for the kids.
The schools are already open.
Oh, they're already open, okay.
Yeah, they're already open, but we need to get the children. There's a lot of children who's suffering from, diabetes, chronic kidney diseases, or other immune compromising diseases, and we would like to get those children to be vaccinated. The other thing is also, when they write their final exams, in our country we call it matric. we need to get those 18-year or 17-year-olds to be healthy so that they can write their final year exams and carry on with their life afterwards, and not keep on closing and coming back for rewriting of exams. Thanks.
Okay. Thank you. Welcome, Chair, to the session. Can I invite Dr. Russell for an update from Australia?
Thank you, and good day to everyone. Australia, as you know, did extremely well, but we are caught with this Delta, and of course, it's a funny situation where we have vaccines is the way to go, at least where I think about 85% of the population have received their first dose, and roughly 68 or 69% of the population has received the second dose. Victoria will be getting the 70% in the next few days. Sydney has passed that. It's funnily situated because Canberra is probably the most worried. They've reached 96%. So you've got this massive vaccination program, but the case-wise, Victoria is still having a problem with cases, and so New South Wales is opening up, I think, on the 1st of November for international travel. Everything's open or supposed to be opening out. Of course, they're first going to be bringing back, as you know, Australia has been locked from March 2020. So they're going to start opening the borders, and we've also got the, I think, a very rapid first dose of 12 to 16 has been very high, and now they've just got the TGA's approval for, or at least they've submitted, and expect that we will start vaccinating from 5 to 11 with the Pfizer vaccine. They put it's been accepted for review by the TGA. So schools are starting back, I think, in the next couple of weeks in staged ways, and but it continues virtually. Western Australia, Sydney, 3 or 4 states have no cases, and borders are still blocked. And Victoria, and of course, 60% of the population are in these 2 states, and those are the 2 that's currently having the big vaccination program and so forth. So they have a plan which, when they reach 80, it'll all open up and so forth. So New South Wales is, I think, tomorrow reaches 80% of vaccination. So they are opening up, and they're giving a couple of weeks and then opening it for international. And the other important thing is that they brought this rule, or they're bringing it out now, no quarantine for international travelers who have the 2 vaccines, had both doses of the vaccine. So that's a good thing, because we've got about 40,000 Australians still waiting to come back to the country. So that's what's happening in Australia. So, you know, New South Wales and Sydney. But of course, all this has meant we've had till today, I think, around 1,400 deaths. That's been probably the good part of it. We didn't have, and that also a large percentage was due to a outbreak in the aged care facility last year in the first part of it. Okay, that's and Dr. Chong, you probably will be able to come by next month. Yeah, I know Dr. Chong is waiting to come and meet his son, who's here. And so is Sajad's son, and so everyone's children are here. Okay, that's as far as Australia is going. It's not like one country, because it's, you know, and this was announced yesterday that people will be able to go to Paris, but not to Perth, from Sydney. From first, they're going to be, Qantas has started, they put the flight. So people will be able to fly from Sydney to Paris but can't go from Sydney to Perth because Western Australia is not going to open till March or February or something like that. So that's the federation working where the Commonwealth government has no power over these each state. But anyhow, Dr. Chong, you'll be able to come.
I'll just share the screen of Australia, and I think you probably, this is what I saw in the Twitter today, which gives a lot of summary of the Australian graphics. So it talks about total vaccine. Yeah.
Yeah, and so that's it. 60. We are getting 80%, 70% in. See, this is giving you the total, but then when you see Canberra, what's called the Australian Capital Territory, apparently is the most vaccinated place in the world. They've reached 95 or 93 or something like that. Sydney is also going up past 80. They'll be going so. But on the other side, Western Australia is lower. Queensland, naturally, because there's no virus, so there's no need, or they're being trying to cajole them to take the vaccine. Yes, thank you for putting that up, sir.
Okay, so I see a special guest, Dr. Heidi here, and you cannot skip my eyes. So I will invite you. I think can you unmute yourself? So we have Dr. Heidi here from World Medical Association. She's a president-elect. Hi, Dr. Heidi, how are you?
Hi, thank you. I'm fine, thank you. How are you?
We are absolutely fine. We always miss you on these meetings. And
I will actually go over to my computer, Zoom on my computer now, because I have you on my phone at the moment. So I'm trying to connect on the computer if you're wondering why I'm looking in at two spots at the same time. Hey, it's so good to see you all. Here. John with computer audio.
Yeah, just connect the audio.
Oops, sorry.
Okay, now we see the World Medical Association logo behind you.
Yes, you saw my workroom, otherwise my office at home. So
the benefits of being digital, you don't know where you are. We just change the background. Yeah.
Exactly. So good to see you. I've got the family sleeping around in the house. It's my parents and my children and the rest of the family. So I was a little bit late in here, but I wanted to hear your report from the different countries, and I realized I'm half an hour late.
That's fine. We just covered Australia and South Africa right now, and we are soon to go for others. So would you like to give some updates on what is happening from the world, like, as a total, and then we can go forward with all the other associations?
Yes. So the world of course, like you probably experience or telling each other, it's it varies. The vaccine penetration is increasing, but very differently. In some parts of the world, they're pushing up about 80% vaccinated of individuals above 16 years of age. And those countries are then also starting to vaccinate from the age of 12. Whilst in other parts of the world, we're lagging behind. And really lagging behind. We also have the huge problem with the different approaches to the vaccines, which is a huge problem since they are not accepted by everyone, and there are a lot of misinformation around the world and misinterpretation of the approaches, if they're successful or not. But when it comes to COVID, the spread is, of course, still wide. There's not so much focus on testing everywhere, but the spread is wider. But in generally, the infections are milder, so there are fewer in the ICU, but still more people in the hospitals. So they are both. We do see a rise in children, and it might be that it's only the reports. Some of the reports, I've talked to scientists about children, and they say that there's a slight higher number of children getting severe infections later, or post-COVID problems that have been at home and not hospitalized, whilst the one being hospitalized have less post-COVID. But these are numbers that we should be taken with very cautious, since we need a much bigger material. We also see, when it comes to post-COVID, that the groups are very differently from the groups that are hospitalized initially in COVID. And I'm not sure if you have seen that pattern either, but what we see that the social in the COVID, the patients hospitalized with COVID, they are often more vulnerable with overrepresentation from socioeconomic poor groups, whilst the post-COVID population are often from a higher socioeconomic group so far here, and especially in Sweden and in many Western Europe countries, in the northern of Europe. But we believe we should be very, very cautious about these results, because it might be biased by stronger groups being better at seeking care for post-COVID. So we are now looking into groups to see if we have been biased in the prioritization of care in post-COVID. So this must be very. I also have a post-COVID unit in my hospital that I'm chief over. So in generally spread wide, not that many hospitalized in the ICU, but still hospitalized. And yeah, into post-COVID in many countries. Very, very brief, I can say.
Thank you. So thanks for the update, and we can move forward. Dr. Chong, would you like to take it Singapore next?
Thank you, Saurabh, and good to see you, Dr. Sternmaren. And welcome to everyone for our weekly meetings. Just to update you on what's happening into Singapore, I'll share screen. Can you just let me share screen, Saurabh?
Absolutely.
Thank you. Yes. Can you all see my screen? Can you all see this update screen?
Yes, we do.
Yes.
Okay, this is our latest update for the Singapore situation. Is dated 15 October, which is yesterday. And you know, we're having a lot of cases now, but the majority of the cases are asymptomatic. About 98.6% of them are asymptomatic, but we're averaging like 2,000 to 3,000 cases a day. Now, we have one of the highest vaccination rates in the world. We are hitting 85% vaccination. Our total is 92% because 8% are children. So we are almost there, but yet we are daunted by the fact that the last few percent includes 60,000 elderly. And as you know, this disease, right, with a lot of comorbidities and so on, will affect those who are in the older age group. And you can see from these data that we have here, the ones in the dark gray colors are those who are 70 and 60 to 70. So you can see that the bulk of the patients who are hospitalized are in the older age group, right? Those who require oxygen are also in the older age group. Intensive care, likewise, we have 48 in intensive care right now. And deaths are also dominated by the older age groups, those who are 60s to 70s. So this is a very difficult situation. So in a way, we're living with COVID, but yet the 60,000 elderly who are unvaccinated continues to have to be a sort of Damocles hanging over our heads, you know, as far as our situation here is concerned. And you can see that there are 16,000 people in home recovery, because most of them, 98.6% of them are asymptomatic. We've asked them to stay at home. and just isolate themselves, do an ART, blah, blah, blah. Most of them are asymptomatic, so they stay at home. And there's telemedicine. If they need it, they can call an ambulance to come bring them to the hospital if they've become symptomatic or if their saturation drops. All the people recovering at home are given ARTs. They are given pulse oximeters. They have a telemedicine access and so on. So this is what we're doing in Singapore right now. So the bulk of them are 16,500 of them right now are in home recovery, stay at home. So this is our approach to living with COVID, as it were. And you can see the community cases is like 2,000 to 3,000 a day. And probably these are also underreported because those patients who are vaccinated and do an ART and are positive, we tell them to repeat the ART 3 days later. If they're negative, life goes on. All right. So there are probably quite a large number of cases that are not reported as well. Now, our modeling shows that with our population of about 5 to 6 million, our modeling shows that we probably need 2 million people to be infected before we become truly endemic. So these are the huge numbers every day, 3,000 to 3,000, 3,500 as of the latest figure today. And we also have the migrant workers living in dormitories. So we're starting to see some dormitory outbreaks again. Do you recall that last year, our biggest challenge was the outbreaks in the dormitory, nearly 60,000 cases in the dormitory, the migrant workers dormitory. And now we are having a lot of community cases, but we're starting to see some in the dormitories as well. And so that's what's happening in Singapore. Welcome, any questions?
Thank you, Dr. Chong. Okay. Can I invite Dr. Monica Vasudev to update for the US side of it? We also have a US update coming from Dr. Monica. She's a doctor in US. She's been regular on our group meetings.
Sorry, before Monica came in, I raised my hand. I just would like to understand. Oh, yeah. Sorry, I just would like to understand from Dr. Chong, why, if you have been vaccinated, why, if you have such a huge population being vaccinated already, do you still have these high cases or incidents of COVID-19? Is that breakthrough infections, or is it due to your type of vaccine that you are using? So I just would like to understand, because it doesn't make sense to me. Thanks.
This is a question we are all asking, and my own understanding is, and of course Monica will correct me on this, is that we have 85% of the population vaccinated. Our target is 92%, so we're 7% short of total vaccination. We started with Pfizer and Moderna, and there's a small group of number using the Chinese vaccines, Sinopharm and Sinovac. But the truth is, we think that there's a breakthrough infection because all the antibodies are waning. So we've started booster shots, and about 500,000 people have done their boosters. We started with those who are above 60, and recently we pushed to those above 50. And now recently, we've just, I think yesterday or today, we are announcing booster shots for those between 30 to 50 or 30 to 49. So we are rolling out booster shots, and we've rolled out something like 500,000 booster shots to date. And of course, healthcare workers as well. So, but the truth is, we have very good public health measures here in Singapore. As you're well aware, I've always told you that all of us carry a phone tracing app that that tells us exactly where we are, privacy issues aside, so that we can do effective contact tracing. So with TTIQ, test, trace, isolate, quarantine, and masking, and very, very good contact tracing, right? Because of the technology, we are able to bring the Delta R0 from 6 to 8, probably 6. We figure from the local data it's about 6, all the way down to 1.45. So despite a high vaccination rate, despite bringing the R naught down to 1.45, we're still getting 3,000 cases a day. So the truth is, there is waning antibodies, and my own local practice is we do neutralizing antibodies. We find that actually a lot of patients have dropped their neutralizing antibodies. And as a result, the Delta comes in, incubates in 3 days, and there is a upswing of the ramping of the immune system, probably a little bit longer than 3 days. So that Delta on day 3 is highly infectious, high viral load, symptomatic. So the vaccine is stopping people from getting severe illness, but it is not stopping the spread of the disease. So the truth is, in Singapore, I believe that if we cannot control it with our TTIQ and our 1.45 R naught, I think nobody can. So that's what we think is going on. I hope I've answered your questions, Dr. Anjali.
Dr. Chong, Dr. Shashank Doshi here.
Hey, hi.
So you have one of the best public health systems. You are very well isolated in an island, and you are very right that if you can't control, probably nobody on planet Earth can. But my question is a little different. Are you all seeing some Delta derivatives? Because clearly there is some degree of immune escape, and and I think the vaccines are all early generation vaccines. So at best they prevent death or prevent severe disease, but they are not able to make a major dent on the overall this thing. We have seen from the Israel experience also. Israel gave booster and vaccinated their entire population.
Yes.
Still, they had the highest number of cases. After Israel, now we are seeing Singapore. So the trend is that probably we will still need to continue our masking and our public health measures for probably another 6 months to a year. And minute we try to unlock or open up, this thing is there. But my question to you is that are you seeing geographic pockets where these outbreaks are occurring, or clusters where they are occurring, or these are sporadic cases in the population in Singapore?
Well, it's a small island, very highly densely populated. So it's difficult to say, in terms of geographic or whatever, but we have clusters. We have definitely clusters of cases, confined to maybe a few blocks of flats or something. We have or a market or something. We have clusters of cases, but so highly densely populated, kind of hard to distinguish geographically, if you know what I mean. We have about 600 square kilometers. That's it. We have, so it's kind of difficult. I hope I've answered your question.
Thank you.
Alvin, you want to ask a question before we can move forward?
Hello, can you hear me?
Yeah, we can hear you.
Yeah, good morning, everybody, and congratulations again, Dr. Samayan, and thank you very much for joining us here as well. This is Dr. Alvin Chen from Hong Kong, Treasurer of the CMAAO, and we enjoyed the WMA General Assembly last night. About Dr. Zhong's situation in Singapore, we always have admiration on the efficiency and effectiveness of all the measures that you're carrying out there. And about the occurrence with still more than 3,000 cases a day, I just wonder, would it be like Israel in the earlier days? That they had a very rapid vaccination coverage, up to 60% at the very early stage. But then they could not vaccinate the children. And they said that their children or the teenagers are people younger than 16 years of age, constitute more than almost 30% of their population. That's why, in fact, although more than 60% of the adult population have been vaccinated, still there's a substantial percentage of the population not vaccinated. So I just wonder, is that the situation in Singapore as well? For the 85% or 83% population vaccinated, is it of the eligible population over the age of 12 or overall? And you had, is it that you had also estimated might be the maximum could be up to 5,000 people infected a day. Was that predicted by some sort of calculation or just an estimate? Or I hope, of course, it won't happen, that 3,000 something is the peak, and then it will gradually come down. But then, do you know how the epidemiologists calculate that? And would you expect that to happen, or I hope so, then it will gradually tail off then?
Okay, so to answer your question, Alvin, our 85% is based on the entire population. So if you take away kids, it's 8% of the population. So our target is actually 92% of the population. We're at 85 now. So we are about 7% away from full total coverage. All right. I mean, excluding children. Until the FDA approves the 5 to 11-year-old, we have not started vaccinating children yet. The other interesting thing is that 3,400 cases today, all right, or as of the last 24 hours. But I think there's a bit of an underestimate, because right now, for those people who are at home, who are vaccinated, and they do an ART and it's positive, we ask them to just stay at home, repeat the ART 3 days later. So we are not capturing those numbers. We're catching everybody else, 3,500 a day, but we're not capturing those people who do an ART positive. We tell them to stay at home for 3 days, repeat the ART. If the ART is negative, we tell them, carry on, life is normal, back to normal. So these cases, we are not capturing them. So my guesstimate is there's probably a couple of thousand of these cases a day. That's a guesstimate. I don't have the exact figure. So that's to answer your question. And for children, the number of cases, I think per day is, yesterday was 200 children below the age of 11. 200 out of 2,700. So that gives you an idea of the spread among children, but right now, 16,000 people are in home recovery. So they're all staying at home and recovering at home. And they're all quite well. If they're not well, we ship them to the hospital. And we're having more deaths, of course, because, unfortunately, a lot of the deaths are in their 70s and 80s, and they are full of comorbidities. So, I mean, okay, from what I understand from my colleagues in the public sector hospitals, we are giving them high flow oxygen, we're giving them steroids, IV remdesivir. But I think a lot of these elderly who are full of comorbidities, I don't think we're doing intubation, if you know what I mean. There's some triaging going on, unfortunately. We're not intubating them, we're not ECMOing them, you know what I mean? We're not doing heroic measures. All right. So there's been an uptick in the number of deaths, especially those who are elderly. Was that helpful?
Okay. Thank you. Alvin, you're mute.
Yeah, thank you. Very helpful. Thank you very much. I'd like to ask whether you have any input here. We always say that we don't really just depend on the neutralizing antibodies. There will be cellular immunity. So even though the level of the antibodies had dropped, but still we have the protection from the cellular immunity. So, but then this sort of breakthrough infections, even after complete vaccination doses. So does it really mean that the cellular immunity is not contributing that much as we expected?
I'll probably leave Monica to answer that, but
yeah.
I think you hit on the right point, because we were so successful in the beginning at controlling the COVID in Singapore. We have a relatively naive, COVID-naive population. And now it's ripping through. It's ripping through the population, and we've converted, with vaccination, we've converted to a mild disease, but it's still ripping through the COVID-naive population. unfortunately. And of course, we are very dense. And even with our 1.45 R naught, it's still ripping through, you know. So I leave Monica to answer that part about the T-cell immunity.
So before I invite her, can I have a question from Dr. Heidi? She has raised her hands.
Yes, I also wanted to ask you a question that was, and you might have mentioned it earlier, but do you see more infections, other respiratory infections amongst children now? Because we have a high way of RS virus in children, and we had last year almost none, and now it's the whole hospitals is clotting. Like in my hospital, in the Karolinska University Hospital, we have only one patient on the grown up on the ECMO, and we have maybe 10 to 12 in the ICU. But the grown-ups, but the children have other infections now.
I think, Dr. Heidi, I think the situation in Singapore is most of the children who are hospitalized because of anxious parents. and I think we don't see any serious, severe cases among children or intubated at all so far, you know. And to answer your question about the RSV, I'm not certain. I will ask my colleagues in the pediatric field. But I know that, for example, our data shows that we hardly got any influenza in Singapore anymore because of the masking. Yeah, our influenza is like, there were certain weeks where the surveillance showed 0 cases of influenza, 0. Yeah. So it's
the same thing in Hong Kong. We also had disappeared for the influenza. Disappeared.
Zero. The surveillance swaps were 0. So it was quite amazing. Yeah, I hope I answered your question, Dr. Stenmarin.
Yes, we also have less cases of influenza. We still have them, but just our theory. Yes, you did. Our theory is that the children did not have any RS virus infections last year, so they have no immunity. They can get all the RS viruses this year instead.
Okay, can I have Dr. Monica now?
Hi, Monica Vasudev. I'm an immunologist in the United States. I'd like to say it's nice to meet you, Dr. Stenmarin. It's the first time I'm seeing you on this forum. I like to bring in a little bit of the immunology. My training is in allergy and clinical immunology. Several issues are coming into play as a continuation of last week. We continue to hear about the FDA advisory group making recommendations about booster doses. Last week, I had discussed about the booster regarding the Pfizer, and that we were planning to expect to hear more about Johnson & Johnson and Moderna. And we heard more recently news about Johnson & Johnson being approved for a booster dose. And this is the advisory committee to the FDA. We don't have final guidance yet. And we've also heard information about Moderna. We are also seeing a decline in the number of new cases in children. In the 5th week in a row, we had a surge of cases due to the kids returning back to school. I'm going to share my screen to show you where we are with the children's cases. So again, I said that we were in the 5th week, and now we saw 148,000 cases up to the week of October the 7th. And this is released by the American Association of Pediatrics. And again, this is the light blue and dark blue colored bars that represent the adults in the light blue and the children in the darker blue. As a continuation about infections in children, there was a study that was released this past week that showed that just like adults, children are susceptible to infection at a rate of 3.5 times more so in schools where there was no masking compared to where schools were masking. That is a segue into vaccinations. We know that the FDA is reviewing information submitted from Pfizer, about 1/3 the dose, 10 milligrams of Pfizer, and it was looking at data from 2 months of data of children 6 to 12, 6 to 11, and they looked at antibody levels and found that they had robust antibody levels comparable to those who were 12 and older. And they didn't look at the endpoints of infection or disease, but said that it was safe and this could be considered for use. When it comes to immunization, immunization is not meant to prevent infection. If you are immunizing to stimulate humoral or T-cell responses, and you have an infection that occurs through mucosal surfaces, you will get the infection. The whole purpose of the immunization is to provide your immune system the robust support it needs to allow it to clear the infection before the infection causes further disease in your body. So we never looked at prevention of infection. It was always about disease. These are continuation of concepts that we had discussed last week. And I just also want to share some information regarding the amount of people who've received immunizations. So if you look at the United States, we have 188.7 million who are vaccinated. Of those, we see that there's anywhere between 65 all the way up to almost 96% who are 65 and older. When you're looking at those who are completely vaccinated, and this is based on the initial series of 1 dose of the Johnson & Johnson or 2 doses of the mRNA Pfizer or Moderna vaccines, the highest vaccination group is about 84%. And you can see a really strong number in those who are 12 and older that are 66%. And unlike Singapore, we don't have the numbers of vaccination rates that you do, and it is 56.8%. If you look at the booster doses were recommended almost unanimously for those who are 65 and older, as it is in most countries that are requiring booster doses, and we're at 13.4%. Those that are getting booster doses above the age of 18 or 50 are falling into those with chronic medical conditions, immunosuppression, or in high-risk populations. So about 5.2% has received the full booster dose. So those are the updates for this week from the United States. There's going to be quite a bit of information coming forth in the next week as the FDA advisory committee's information is being reviewed by the FDA. I do hear of many reports of people coming from other countries, coming to the US, getting additional booster doses with Pfizer and Moderna. I get personally asked questions about, I have someone who has received Sinopharm, Sinovac, or they've received Covishield, Covaxin. They come to the United States, should they get 1 booster dose or should they get 2 booster doses, depending on how long they're staying here. So that's really interesting because I think we are in uncharted territory when it comes to the booster doses and how many vaccines are available and when they are administered. Thank you.
Thank you, Dr. Monica. Can I invite an update from Pakistan? So Dr. Salma, Dr. Ashraf, and Dr. Sajjad, can you please give an update?
Good morning and good evening to many other people. In Pakistan, the situation is, alhamdulillah, improving. We had a bad state about 2 weeks and a month back, where our average reached 3,000 to 5,000. But nowadays it has declined. Like today, there were only 890 people. Out of them, in the last 24 hours, only there are 24 people who have died, where previously it had also reached the limit of 100 and 150 sometimes. At the moment, we have 27,000 active cases, and the people so far who have died in Pakistan because of COVID are 28,000. About 15.8% of our population is vaccinated, which is not really a very good rate. I hope it improves with time. And now that the schools are opening, I'm keeping my fingers crossed. All the schools have opened. So I'm keeping my fingers crossed that the situation doesn't deteriorate, but it gets better. Otherwise, with the way people are behaving with COVID, like really avoiding masks and socializing, we still have a good ratio. And if our people are careful, I'm sure this will drop down more. So that is so far for Pakistan. We've started the third booster dose for people who ask for it, especially those who are traveling to other countries or whose antibody levels has fallen down. But again, now there is a gray area because we don't know about cellular immunity. I was hoping we get good news and some good papers from you all so we know where we stand. So that is all from Pakistan. Thank you.
Dr. Sajjad and Dr. Ashraf, would you like to add anything?
Thank you very much. I think Professor Salma has explained each and everything about Pakistan. To Almighty Allah, what we are having today, it is better. And just to add up that the positivity in Pakistan, it is 2%. The thing which I would like to share that we are now having the issue of dengue after 2019. Now on the second year after the 2 years, now in Pakistan, again, we are having this problem of dengue. The cases is on high rise, especially in Punjab, one of the biggest provinces in Pakistan, the Karachi. And there is the mixed pathology about the cases. There are very few indeed, but there are who are suffering from the COVID and at the same time from dengue. So this is one of the issue in Pakistan what we are facing. As Professor Salma, the president, has said, having this opportunity, I will welcome and appreciate Heidi taking the office of President of the World Medical Association. Thank you very much indeed.
Thank you so much. And yeah, I need to correct myself. I did mention president-elect. I didn't realize the time, has quickly passed on. So she's the president now. Can I invite Dr. Marie from Japan for a quick update? And I'll come back to you, Dr. Elvin, after this. I'm sorry, I just saw you. Yeah.
Thank you very much, Sabra. I'm sorry I cannot attend the meeting a couple of times. Now here in Japan, it seems like we survived the 5th wave. We have under 1,000 people has been tested positive during a couple of weeks. And yes, and also Dr. Monica mentioned that there are many RSV and non-COVID viral infections. It's same in Japan. We saw many various types of viral infection right now. So it's kind of complicated, but we are surviving and prepare for the 6th wave, maybe during the winter time. And about 70% of people has been vaccinated fully. So that helps the survive of the 5th wave, I believe. We continue to vaccinate people. And also we see some patient has the cardiovascular carditis after Moderna vaccination. But many are cured, just seeing no medication or no hospitalization. Thank you.
Thank you. Thank you, Mary. Elvin, your question, please.
Yes, thank you. Thank you, Sarah. Yeah, dear Monica, I'd like to ask a question again. So you probably, I think in Taiwan, it's the same situation like Singapore and Hong Kong, and also in mainland China. I don't know whether our Taiwanese colleagues are here. Now, we don't have significant children being affected by the COVID-19, even in the peaks. So, and for those children who were really infected, we didn't have any significant complications, so no deaths at all. So that's the situation for the Chinese population. So I just don't know whether in USA, where you said that there's a quarter of the infected people are now children. Is that right? So for such a significant number of children being infected, what is the proportion of different ethnic groups that were being infected? Is there any difference for the Blacks, for the Asians, Indians or Africans or the Caucasians. And I just, this is out of interest, my personal interest as well, because this is some way that we have to face our population in Hong Kong when we are stepping up our vaccination drive in Hong Kong, when the people here in Hong Kong say that, after all, the risk for our children is low in the COVID-19, then why should we go on for the vaccination for the children when there is a definite risk for myocarditis, especially in boys? Then is the benefit really outweigh the risk? And that's the question we have to be asked from the population as doctors, you know. So I just wonder if that is a genuine situation, that the Chinese people really have less risk for the children to be affected by the COVID-19. So I just wonder if there is any segregation of the different ethnic groups in the data from the USA. First is like this. And the second thing is about the cellular immunity. So I just wonder, of course, whether cellular immunity is really significant in the protection of, longer term protection of the vaccinees when the neutralizing antibody level had dropped. Dr. Zhang had mentioned to us a couple of months ago that the level of the antibody will drop to almost to be almost like zero half a year later. Now that is even more significant for those killed virus vaccine, like the Chinese vaccine, you know. Of course, I should not label like that, because Chinese, mainland Chinese are also now producing vaccines other than killed virus vaccine, you know. They are now producing mRNA vaccines as well, and also adenovirus vaccines. So I think the term so-called Chinese vaccines have to be corrected later on. They don't just produce killed virus vaccines. Okay, so may I really ask, perhaps it is the cellular immunity that is not so serious in children, especially then there is no cytokine storm like that had occurred in the adults that account for the complications or the seriousness of those COVID-19 infection. So I just wonder if, Monica, you have this sort of questions and answers in mind. Thank you.
Thank you so much. I'd like to share this graphic with you. So this is published in a news article from October 14th. And this is a summary of the same data that I showed you from the American Association of Pediatrics. This is speaking to the concept of talking about that it is not affecting kids at the same level as it is for children, because potentially they don't have the same level of cytokine storm. So what is the death rate that we saw from the age group from 0 to 14 in 2020 and 2021? And we see the big peak here is when we had the surge. And yet COVID deaths among children are still rare. They make up less than 1% of all COVID deaths for ages 11 and under, compared to those that are 12 and older. When it comes to looking at your question about the demographics and the makeup of those children who have been infected or who have been sick, that data has not been made available as easily from the American Association of Pediatrics when it comes to what are the number of people that are testing positive, what is the positivity rate. Now, I don't know if it's because they're not collecting the data at the time of all these kids that are testing, so that we don't have a breakup. But if you do look at the different states and looking at where you are, it seems that for some people like New York City and New Jersey, you're having higher levels of hospitalization rates, as well as for Arizona. But that's not going to give you a complete idea of the different ethnic backgrounds that are present in terms of the infections. The third concept you asked about was cellular immunity and humoral immunity. Now, we do know that antibody levels fall, but don't forget that now, as we're so far into the pandemic, we have had those who have had symptomatic and who've had asymptomatic infections to various different variants. We know that the Delta variant has a very high R0 factor, unless you live in Singapore, which they've done a good job with. But it is, your immunity is a function of what variant you got, the viral load you got, whether or not you had a native infection, natural infection, followed by immunization. And we have seen many reports now that there's something known as super immunity or hybrid immunity, where if you get the natural infection first, in most cases it was with the Alpha variant, and you followed it up with the immunization, your immunity is much stronger. I had shared a slide several presentations ago that they looked at B-cell immunity, T-cell immunity, and that there was variation in the immune responses in native infections among individuals. So when it comes to looking at, are we looking at humoral immunity? Are we looking at cell-mediated immunity? I do not think that the answer is very simple. I think you have the individual factor, and then you have the issue related to the immunization timing at the time of whatever variants you had present. When we measure antibody levels, are we measuring total antibody levels? Are we measuring spike antibody levels? When they looked at the antibody levels for the kids in the study looking for immunization for age 5 to 11 for the Pfizer study, they never told us what was protective. We don't have any idea of what level confers what level of protection. And again, that level might be variable among different children. I'm going to extrapolate this concept of antibodies to my particular field of medicine, which is an allergy. I also do allergy and clinical immunology. So we have kids that come to me for example, peanut allergy. When a child has a peanut IgE level, that IgE level doesn't have a hard stop peanut-specific IgE that tells me that a patient is going to have an anaphylaxis or systemic reaction to peanut. For a child, one child, a level of 3, for example, might be associated with a failed peanut challenge. And for somebody else, it might be a value of 1.2. So I think it's a really slippery slope when we're looking at antibody levels. When you're comparing your own antibody levels from point A to point B with time, and you say, I'm having a fall in your antibody levels, maybe what happens is that your cell-mediated immunity kicks in when you get infected, and then you have a robust antibody response at that time. So just because you have pre-existing antibody levels, it doesn't mean that you may not generate a great immune response. This is a really long-winded answer to say that we don't know.
Yeah, thank you very much, Monica.
Thank you. Can we have a quick update from who's left? Alvin, have you given an update from Hong Kong?
Well,
you've been talking. I just thought you've not given an update. So, yeah.
Thank you. Well, not much change in the condition in Hong Kong. Our situation is that we still follow our mainland's policy of zero tolerance. We could not afford to have the coexistence with the virus to make it endemic, because only 30% of our elderly population is vaccinated so far. The government is stepping up the momentum to have the vaccination drive in the elderly people to make it more convenient for those people to have vaccinations in their estates that they live in. But then still, I think some of the elderly are still scared of the so-called complications after having the vaccinations, and the vaccine hesitancy is still there for the elderly people, and so it's still not much over 30% for the over 70 years of age group, and so when the border is open, we are afraid that these elderly people population will be at risk, high risk. And so of course, we still could not yet have the border opened, not between mainland China and Hong Kong, and not internationally, of course. So of course, we dream that this will happen very soon. Well, but we really have to keep our fingers crossed. And then our death rates have been stagnant. No new deaths for I think a month. And then we still have just imported cases. Just only about one community case for the recent 2 months. But then still, the mainland China still did not open the border for us. And that had really given a big blow to our economy, in fact. And I still have some glimpse hope of the opening of the borders soon, because after all, for the 1.4 billion people in mainland China, now they still just have about say 30 or 20 cases a day, but most of them were imported, I guess. So I hope when the population of the mainland China had about over 75% or even 80% vaccinated, then I think the mainland China might open the border soon, and then Hong Kong could have overcome this hurdle of being isolated in the world for more than a year already. So hope we can follow the steps of Singapore soon. Thank you.
Thank you, Alvin. I think Nepal has left, but they have mentioned in the comment box that there is a national festival holiday since last 5 days. So all routine services are closed and emergencies are open. And I just want to share, I don't think Dr. Shashank Joshi and Dr. Matsunda Pillai has left. So I just share a slide for a very important data, which I think it will be very important for everyone. So this is the Indian vaccination drive equation. At the current vaccination rate, 35% of the population will be vaccinated by December 2021. Obviously, the aim is to stop the third wave, which we all are wondering. 60% of the population with the dose is the target, but I don't think we can achieve that. Required rate is about 14 million per day vaccination. Actual for the last 7 days is only 5.4 million per day. There's a daily shortage of 9 million per day. But if you talk about the yesterday data, there was only 3 million vaccination happened per day, which means the shortage of 11 million. So definitely we will not be able to achieve the 60% population by 2021. And this is the global vaccination summary, China being the most, followed by India and United States. India is doing pretty okay right now. Our cases are going down, even the Kerala has been settled down. And let's see, there's also a study which recently came up, which says, especially in Delhi, that the COVID outbreak shows that the herd immunity was against the Delta variant, which is difficult. So with this note, Dr. Chong, you want to speak something? Yeah.
Saraf, no, just to answer Alvin's question, yes, one of the things we've done is that Singapore has opened vaccination travel lanes with several countries. I think 14 countries to date, most of Europe, all right, and South Korea as well. So this is all in line with opening up, and therefore, there is an objective to all this, that living with the virus and opening travel lanes, vaccinated travel lanes. VTL means that when you travel, when you come back from those countries, you don't need to be quarantined. You just need to do your PCR swab on arrival. Thanks.
Okay, thank you. see Dr. Kazi, you have not spoken. Would you like to speak something?
Okay, thank you, Sarah.
Thank you.
And first of all, I would like to congratulate Dr. Heidi for taking over as President of UMA. Thank you, Dr. Chang, for chairing this wonderful session. And it was really good to see and listen to the country updates around the world. One thing I would like to say that we should remember the WHO slogan, nobody is safe unless everybody is safe. So in Pakistan, definitely, as Dr. Salma Sindhi and Dr. Nizami pointed out, that the graph is definitely dipping down, despite the fact that we have fully vaccinated only 15.5% and first doses of 29%. And I think we should continue with vaccination and following the SOPs, wearing masks, avoid crowd, hand hygiene, and then, avoiding sick people, getting close to them, and then, of course, living healthy lifestyle. And to boost our immunity, we should have good nutrition and all of that. So we need to follow that so that we can have a happy, living, new world. Thank you, Sarah. Thank you.
Thank you so much. Anyone with the final comments or questions before we end the question? I would also like to invite Dr. Heidi for the future meetings. We do have a lot of future meetings coming up. We have next week, we have a cardiologist from US. We also have a Canadian Medical Association joining in the first week of November. We also have a lot of topics on the dietitian and nutrition. So we are covering all angles, all aspects, and trying to cover up. We have also covered telemedicine over the last few weeks. So, these are some good think tank meetings going on, and it really helps at least the Asian countries for now. And we are trying to cover Europe and US as well. So any final comments before we end the session?
Happy to join in.
Thank you. So Dr. Heidi, can we have some take-home message before we can end? We usually skip the meetings, like, we usually have more. So today we are ending 5 minutes early. So can we have some take-home message before we can close the meeting?
Well, I would say, like some of you have mentioned, we have to live with the virus, and we are slowly getting there with the systems to have a better distribution of vaccines. Slowly but steadily, and some parts of the world are opening up, like Europe and Singapore, and now from the 8th of November the US will open to travelers as well, and the routines are slowly being harmonized, which is important, because just as WHO pointed out, it needs to be some general or common ground to handle this. So slowly opening up, and also regarding other infectious diseases as well, because it can't only be COVID-19. We do have a lot of other infections to handle as well, and vaccination programs. So that will be, we are slowly getting to a steady state where we live with the virus and its mutations, and also noting that the mention of a sixth wave or new mutations, the awareness is high, but the knowledge is much higher now as well. So it's a higher confidence in handling of the virus, and also the supply chains. The supply chains are being much better, and also the logistics of distributing vaccines. We still have the big issue about the collaboration on the international level on distribution of vaccines, and securing that everyone in the globally have access to vaccines. That is not solved internationally.
So, but we're getting there.
Thank you so much. So with this note, we would like to end our 80th session on International Weekly Meeting in association with CMAAO. And yeah. So
Saurabh,
we would, yes.
Can I say something?
Go ahead.
Okay.
Yeah, go ahead.
Thank you very much. Actually, I've joined late. I don't know. Maybe the situation in Pakistan have already been mentioned by our colleague. I just request to discuss in the next meeting how many doctors are expired during this COVID national country. The National Association should mention, and what are the reason and how we prevent this type of death during pandemic. Can we discuss in the next meeting? And lastly, I must congratulate Hedi for being a president of WMA as a Secretary General Pakistan Medical Association.
Thank you. We would surely try to cover that in the last half an hour. We have a speaker for the next week, but yeah, we will try to cover that part. I would request everyone to do talk about the sad death of the doctors in their own country, and what we can have a certain debate on that, and that can be carried for the next week. So thank you everyone for joining in. Stay tuned. Next week, same time, every Saturday we are meeting on the international forum. Where more like many countries are joining in. And with this note, thank you so much. See you soon again.
Thank you.
Bye.